Hello, hello. This is Donna Denson, the Dynamic Diabetic, coming to you today with a Diabetic Minute for everyone who wants to get and stay healthy. And today we're going to talk about your back. Back pain. Like, when you have back pain, when is that an emergency? What are the signs to look for that this is something to worry about? Because most of us tend to, that'll get better. It'll be all right. I'll ride it out. I'll just lay low for a few days, right? Well, what you need to know is that lower back pain is the number 2 most common reason for disabilities around the world. Number 2, okay? 80% of us are going to experience some kind of back pain sometimes in our lives, but usually it's a mechanical thing, a sprain, a strain that goes away, and we're fine. But when is it not? Because the lumbar area of your back, okay, it's like a crossroads. It's got bones, joints, nerves, everything pulling together that support and strengthen and give us flexibility in our body. So anything that goes on there has potential to affect a lot. We get muscle aches, we might get shooting, stabbing, burning, pain, maybe even radiate a little down our leg, but it goes away. But what if it doesn't? What are the signs that you need to know to make sure that you're taking care of yourself? Diabetic, not diabetic, doesn't matter. This is important for everybody. So, number 1 thing would be a sports injury. Most of us have had some kind of injury doing something like that. And at first, it's kind of hard to tell how severe it is, right? Time gives us that because it does not get better. It does not get better. And that's when we know we have something more serious than just a little sprain. Number 2 would be back pain that doesn't stop, okay? That it stays around, it doesn't go away in a few days, it intensifies or becomes excruciating. It could be a kidney infection, it could be a herniated disc, it could be a fracture or an osteoarthritis kicking in. Not good. So what if you have an accident? Have you ever had an accident and at first you're like, I'm okay. But then like the next day, it's like, no, I'm not so okay. I don't feel so good, right? That has happened to a lot of us. And so with that kind of pain, it might be a spinal injury or a pathological fracture. Well, what that is when you have, say, a growth that is juggled, loosened, somehow changed in the accident, and then it becomes the source of the pain. My sister actually had this, okay? She had an accident. She was hit from behind. The steering wheel went into her abdomen, and she started having excruciating pain. They found a growth the size of a cantaloupe, a cantaloupe, inside that she had no idea was there until that accident. So that kind of thing can happen. Unfortunately, they were able to remove it then and keep it from developing into something else. If the pain spreads, if it moves down your legs, one or both legs, especially if it goes below your knee, then or you get tingling, numbness, or weakness, yeah, that's an emergency. The next one is, what if you lose control of your bladder or your bowels? You totally lose control, right? This is definitely an emergency because this could be lead to paralysis of the nerves that connect your spinal cord and your spine to those organs, and that would be horrible, right? Sometimes people experience something called foot drop, and what that is when you're walking, your toes want to drag, like they drop when you pick your foot up. And if you notice that, it could be a sign of serious neurological damage. So you definitely want to get that checked out because it could become permanent. And if you have, lower back pain and suddenly it radiates to your upper back or to your abdomen, that could be a sign of an abdominal aortic aneurysm or a chest tumor. That's really serious. Yes, it's an emergency. So any back pain that lasts, that persists, should be checked out. If you go 2 or 3 days and things are not better or worse, then you definitely have to get it checked out. And some of these I've told you right away, get it checked out, okay? And why? So that it doesn't develop into something more severe, something that is permanent, something that can change your life for the worse. This was the simple offering today of some things to watch for. Again, knowledge is power. So now you have more knowledge about your back. You know some things, and you may have known some of these already. It's kind of common sense for some of it, but now you have a better foundation to make judgments on if you have some back pain. Is it an emergency? Now you'll know. I hope you will share this video and share it and share it. I hope you will subscribe to wherever you're listening to this. I hope I found you safe today. I hope I found you well. And as always, I hope I found you happy. This is Donna Denson, the Dynamic Diabetic. Thank you for being here. May God bless and keep you until we connect again. Have a terrific day. Bye-bye.